So in terms of the signs and symptoms of breast cancer, this is one of the reasons why we are encouraging us to get screened, because when it starts, it's very silent. You are walking around thinking that everything is okay, but there is a cancerous process that has started. So at the initial stages, we say there is no symptom at all. You will not know unless you go searching for it. And then most of the times, what you actually feel is a hard lump sitting right inside, and it's usually not painful, although some types of breast cancer can have a painful lump, but most of the time it's painless. So the first sign is the painless lump sitting in the breast, and then with time it gets bigger, and at a point there are some skin changes. So you realize that the skin around the breast can start getting some irritations, rashes. It can also become ulcerated like a sore. There is also something significant that we call dimpling. So the dimple that sometimes we have right here, because the cancer cell is inside, it's more of pulling onto the skin. So the skin around the breast becomes dimpled. And once the disease is advancing, it gets to the point where we describe the breast as what we call pod orange, the same way orange looks like, with all those dots on it. So when the disease progresses, your breast can actually look like that, like an orange with all those dots. And for your nipple too, there are significant changes that would draw your attention to let you know whether this could be cancer. Most of the times, women have their nipples standing out very nicely. We say it's everted because it's standing out. But in cancer, what we realize is that the cells can pull onto the nipple. So there's what we call nipple retraction. So the nipple is pulled inside. If that is how your nipple is, in terms of if you naturally have a retracted nipple, that shouldn't be a problem. But if you have an everted nipple and all of a sudden it becomes retracted, then that's of concern. Aside that, even the nipple itself can also become ulcerated. And nipple discharge is also something important as a symptom in breast cancer. Not any nipple discharge, especially when it's bloody. We know that a lot of young women, certain times of your life, you would have some serous, clear fluid coming out of your nipple. Most of the times it's not that. But if you see a bloody nipple discharge, then it's of concern in breast cancer, or it's one of the symptoms that we talk about. Once the disease progresses, remember we mentioned it can spread to all the other parts of the body. So for instance, if it spreads to your head, the brain, you can have severe headaches, and then you can even have seizures. Unfortunately, some people present late at this point. When the cells go into your lungs, you can also have chest pain. You can have difficulty in breathing as well. And once the cancer cells go into your liver, you can have what we call jaundice, yellowing of your eyes, and then you can have abdominal pain. It can also cause fluid in your abdomen, what we call ascites. Another important part is when the cancer cells go to your bones, and that one it can present with bone pain and sometimes what we call pathological fractures. The bones can just fracture without any specific cause unless you go find out and you realize this is the cancer mets. So these are basically some of the signs and symptoms to look out for in breast cancer. Remember that if it's early, no signs at all. So it's important for us to always go check in to be sure that there's nothing happening on our blind side.